Well, everybody, this is Gary. Today is Monday, November 15th, 2021. It's 5:40 p.m. Eastern Standard Time in Rochester, New York, in the United States, and this is my coping with schizophrenia blog entry for today. I didn't make a video yesterday because I was having a really hard time. I was actually having a hard time on Saturday too. But I was able to avoid going to the psychiatric emergency room. Um, for some odd reason, I was feeling really agitated yesterday. I kind of felt my psychosis creeping in. My delusions were getting pretty bad. My hallucinations were pretty intense. My anxiety levels were through the roof. Um, my depression was pretty bad. Didn't have much motivation to do anything. Um, so I didn't make any videos yesterday. And the video I made on Saturday was pretty short and didn't give out much information. It was only about a 5-minute video. And I was just basically saying my symptoms were really intense. I was very fearful. I was filled with anxiety, anger, agitation. Agitation is a word that for me covers many different things when I use that word. It covers hallucinations, delusions, anxiety, fear, depression, physical agitation and inability to sit still, pacing back and forth, racing heart, sweating, upset stomach, emotionally unstable in a way, just really, really afraid and scared and physically uncomfortable and physically agitated, unable to sit still. It wasn't akathisia. Akathisia is caused by certain antipsychotic drugs, usually the older ones like Thorazine or Stilazine or Haldol or Prolixin. It wasn't akathisia. I've experienced akathisia before, and that's similar to agitation. It's a physical need to keep moving and restlessness and inability to sit still for very long or lie down for very long. It makes for very difficult to fall asleep. It's a side effect of certain older antipsychotic drugs. I'm on Seroquel and Zyprexa, which are, quote, newer antipsychotic drugs. Um, they really don't, for me anyways, cause akathisia. So I don't think what I was experiencing Saturday and yesterday was akathisia. I was just generally very, very afraid, very physically agitated and restless, unable to sit still, filled with a lot of auditory hallucinations, depression, anxiety, fear. And fear and anxiety are not the same thing, really. Anxiety is just kind of a general sense of dread of something non-specific. Fear is something else entirely different. It's a much stronger emotion than anxiety. It's akin to being in physical danger of something without actually being in physical danger. It's a very strong emotion, and that's what I was feeling Saturday and yesterday. I think one of the problems is I spend too much time alone. I don't get out enough. I don't exercise enough. I don't talk to other people enough. And this lets my mind start running in circles. My fear, my agitation just feeds on itself and it becomes a vicious circle. If I don't have other people around me to bounce ideas off of, then I have no way of judging reality outside my own mind because I'm not getting other people's opinions and perspectives. So it's a major mistake if you have schizophrenia or schizoaffective disorder to spend all your time alone. That's not really a good idea at all. Me and my therapist have gone over this subject several times. I still spend too much time alone. Um, I need more people to talk to. It's one of the reasons I took on a therapist. But a therapist shouldn't be your only source of a person to talk to. Human beings are social animals. We need friends. We need acquaintances. We need coworkers. We need people around us to be able to talk to them, to be friends with them. And that's something that I definitely need to work on. The more time I spend alone, the poorer my social skills become. The poorer my social skills become, the less I talk to other people for fear of embarrassing myself or getting myself into trouble, which just leads to more isolation, which just aggravates my psychotic symptoms. It aggravates my hallucinations. It aggravates my delusions, my paranoia, my hallucinations. It aggravates my anxiety, depression, fear. Um, Yesterday around 6 p.m., I was going to make a video, do a live stream like I am right now, but I was so agitated. I took a Zyprexa, 5 milligrams, which is an antipsychotic, because I felt my psychosis creeping in. And I took half a milligram of Klonopin. I took the Klonopin and Zyprexa together because alone each drug may not have been enough to bring my agitation under control. My agitation, as far as I could tell, was clearly a mixture of my psychotic symptoms and my non-psychotic symptoms of fear and anxiety and phobias. Um, I have a phobia of cockroaches, and about 2 weeks ago, my apartment was infested with cockroaches. I started spraying pesticides everywhere, which is not only dangerous to my health, but it's also a violation of my rental lease in my apartment. And I went to the psychiatric emergency room, which of course did get rid of the cockroaches, but I needed to take a break from the situation because my behavior was getting completely out of control. I went through 3 cans of pesticides in 2 days, and that's a waste of money and it's dangerous to my health. I was breathing in the vapors from the pesticides for like 3 days. I wasn't sure if I was breathing properly. My thinking and my psychosis got completely out of control. My behavior got completely out of control. So I had to go to the psychiatric emergency room. I was seen relatively quickly. They gave me some Zyprexa and Klonopin. I came home. I had to wait till Monday to call the landlord to tell them that I had cockroaches. They had an exterminator come the following Tuesday. This is about 2 weeks ago, as of tomorrow. Um, and the exterminator did come in that Tuesday and spread poison bait to kill the cockroaches. And I haven't seen any cockroaches since then. But I have been living in fear of seeing cockroaches. I have an overwhelming fear, not just an anxiety or phobia, but an overwhelming fear of cockroaches. And it borderlines on psychotic thinking. So that's one of the fears that I'm living with. Um, so I wasn't doing well yesterday, so I took a Zyprexa and half a milligram of Klonopin. I meditated for about 3 hours, and I took the rest of my night medications, my Seroquel, um, gabapentin, which is also known as Neurontin. I took my medical medications, which I take for high blood pressure, acid reflux. Um, I take laxatives to prevent constipation, which is caused by my psychiatric drugs. So I took those as well. I eventually did fall asleep, and I actually slept pretty well. I slept through the night. So I'm feeling more stable today. The less sleep I get, the less stable I feel, and the worse my symptoms get. And that's true for anybody with schizoaffective disorder or schizophrenia or any psychosis. The less you sleep, the worse your symptoms get. For me, my hallucinations get worse when I don't sleep. My paranoia, my fear, my delusions, my hallucinations, my depression, my anxiety, my fear, they all get worse if I don't get a good night's sleep. Um, Meditation, of course, doesn't cure psychosis. Um, that's why I took the Zyprexa for Klonopin, because Klonopin also doesn't treat psychosis. Um, but meditation helped me reduce my anxiety and my fear. Um, it got me calmer, less afraid, less physically agitated. And I can't emphasize how important it is when I use the word agitation or agitated. But I mean, I'm physically agitated. I'm unable to sit still. I'm unable to stop moving around. Um, and that's due to my psychotic symptoms. It's a very severe form of restlessness, sort of like akathisia, but not quite the same thing. A little bit different. More fear involved than anything else. Um, so I was having a hard time Saturday and Sunday. But because I do have the Zyprexa and Klonopin, and I'm able to meditate, meditation helps control my anxiety, controls my insomnia. Um, of course, I don't use meditation by itself to treat my mental illness. That's why I see a psychiatrist and a therapist. Um, meditation doesn't replace my psychotherapist. It doesn't replace my psychiatrist. It doesn't replace my medical doctor. It doesn't replace any of my medications. Um, I'm not a religious person. I'm an atheist. I don't meditate as a Buddhist or a Christian or a Muslim or a Jew or a Hindu or New Age. That's not what I do meditation for. Meditation is just simply a way of calming down, usually through some sort of visualization. And there are plenty of YouTube videos out there for visualization meditation. Some of the best are Jason Stevenson. His channel is pretty good for meditation. Meditation Vacation is another good channel for meditation. Michael Seeley is a good channel for meditation. Tansy Forest is a good channel for meditation. They're all visualization type meditations. Um, and yes, some of them kind of creep into New Age religion, but that part I ignore because I don't believe in that stuff. I don't believe in throwing out the baby with the bathwater. If a meditation channel helps me meditate and calm down, then I can ignore any of the supernatural nonsense like chakras and spirit guides and, you know, out of body experience and astral projection, all that nonsense. Um, so I'm doing better today. Tomorrow I am seeing my medical nurse practitioner to talk about my high blood pressure. She just started me on a medication for high blood pressure. I forget the name of it. Um, but I'm on two medications now for high blood pressure. And it's important when you have psychotic symptoms to take care of your physical health. Of course, medications are not the only way of controlling medical problems. I am overweight. I do overeat. I don't exercise enough. I take in far too much salt and sugar and fat. Um, those things affect my blood pressure. So I need to start exercising more, changing my diet a little bit, not drastically, but to a more healthy way of eating. Even if I didn't lose any weight, I still need to eat healthy because I have a tendency to eat a lot of junk food, which is common when you're on Seroquel. It increases your appetite and makes it hard to be satiated. You're always hungry. You're always eating. You're always going to the store to buy junk food. Um, I've had this problem before. I'm up to 224 pounds, and I'm only 5'9", so I'm definitely overweight, and it's contributing to my high blood pressure. And I don't exercise enough, especially during the November, December, January, and March winter months. I have a tendency to exercise less often, which only makes my blood pressure worse. So I have a lot of work to do. One thing I have accomplished is that I'm not smoking cigarettes. Um, I did smoke 2 packs over the weekend, but I went back to not smoking again. I'm on nicotine lozenges to deal with the nicotine cravings. Me and my psychiatrist agreed that even if I took the nicotine lozenges indefinitely, that's still better than smoking cigarettes. So we didn't set an end date on when I would stop using nicotine. We did lower the dosage of the nicotine lozenges from 4 milligrams to the 2 milligram tablets. And nicotine lozenges are different than nicotine gum. You don't chew them, they dissolve in your mouth. And if you see any white stuff on my lips, that's from the nicotine lozenges that I have in my mouth. And so I switched to 2 milligram nicotine lozenges, and the goal is to stay off cigarettes because the nicotine lozenges are certainly safer than smoking cigarettes. 2 weeks ago, I went to the hospital with chest pains. I was afraid that my smoking had caused heart damage and I was having a heart attack. Turns out I wasn't having a heart attack. They did an EKG. My heart was normal on the EKG. They took a chest x-ray. My lungs were as normal as they could be considering I've been smoking for 30 years. Saw my cardiologist a few months ago. My heart is pretty healthy considering that I was a heavy smoker for 30 years. So I'm grateful that right now, at least, there's no permanent damage to my heart. There is some permanent damage to my lungs, and I want to prevent it from getting any worse by not smoking anymore. So I have no excuses. I have to take better care of myself physically because when my physical health gets worse, my mental health gets worse, and it's all an interconnecting web. You need friends, you need exercise, you need a good diet, you need your medications, you need your therapist, you need your psychiatrist, you need your medical doctor. You need to take the medications your medical doctor prescribes as well as the psychiatric ones. And another thing that I'm going to be doing hopefully soon is going into a psychotherapy group, which my therapist is trying to arrange. She made a referral for it and didn't hear anything back, and so she sent the referral back out. I think I could benefit from group therapy. It'll give me a chance to talk to other people with mental illness and get their feedback. And it'll also help improve my social skills. So that's the update for now. Like, share, comment, subscribe. Share my videos on social media like Facebook and Twitter. And press the notification bell if you want to know when I put out videos. If you want me to do a video on a specific topic, let me know in the comment section.